Vanakkam, good morning. In this video, we are going to discuss about the anticoagulants. Anticoagulants are substances which prevent the blood clotting. Is anticoagulant. Richard Lewison discovered the anticoagulant in 1914. Types of anticoagulants. Anticoagulants has 4 types. Anticoagulant used in laboratory for investigation purposes. Anticoagulant used in blood bank for the blood transfusion. Therapeutic anticoagulant used for the treatment of the patients. And natural anticoagulants. It is normally present in the human body. So, laboratory anticoagulant mainly used for the investigation purposes in the laboratory. When we collect the blood from the patient or subject, so anticoagulant is used for prevent the clotting. Most commonly used anticoagulants in the laboratories are 3% 8 sodium citrate, double oxalate, potassium and ammonium oxalate. Potassium oxalate shrinkage of the RBC, causes shrinkage of RBC. Ammonium oxalate increases the size of the RBC. So the double oxalate does not change the RBC size. So double oxalate is used. And ethylene diamine tetraacetate, EDTA, most commonly used in the laboratories. Sodium sulfate. These are the anticoagulants most commonly used in the laboratory for the investigation purposes. So laboratory anticoagulants: sodium sulfate, double oxalate, EDTA. These are activated by precipitate the ionic calcium and prevent the clotting. So mechanism of action of the laboratory anticoagulant is precipitate the ionic calcium and prevent the clotting. The laboratory anticoagulants mainly used for the determine the erythrocyte sedimentation rate, packed cell volume, RBC count, and estimation of the blood urea and blood glucose level. Blood bank anticoagulants used for the store the blood before the blood transfusion. Most commonly used blood bank anticoagulants are acid citrate dextrose, that is ACD, and citrate phosphate dextrose, CPD. These blood bank anticoagulants precipitate the ionic calcium in the blood, help to store the blood in the blood banks. Usually in the blood bank they store the blood for the 3 to 4 weeks. Therapeutic anticoagulants used for the treating the patient. Most commonly used therapeutic anticoagulants are heparin and dicumarol. Heparin is the natural anticoagulant. It is produced from the mast cell and basophil. It is only introduced intravenously. It actions last for 3 to 4 hours. It is short duration of the action. It can used in vivo or in vitro. In vivo means the heparin acts within the body. So we can use for the patient, that is in vivo. In vitro means we can collect the blood from the body through and we can use the heparin to store the blood, that is in vitro. So we can use the heparin as in vivo and in vitro. So mechanism of action of heparin is inhibit the action of thrombin. So it has the antithrombin activity and facilitate the antithrombin 3. So this is the main function of the heparin. It is also inhibit the factors, clotting factors 12, 11, 9 and 2. So uses of heparin. Heparin mainly used during open heart surgery. So in the open heart surgery, heart lung machine used. So it is more prone for the clotting. So we are using heparin. And during the renal dialysis for the chronic renal failure, heparin is used. And acute myocardial infarction. So if the patient is coming little later time, means we cannot use the thrombolysis like streptokinase, urokinase. That time we can use the heparin. And animal experiments also we use the heparin as the anticoagulant. Dicumarol is the synthetic oral anticoagulant. It used only in the vivo within the body. So mode of action of the dicumarol is the prevent the synthesis of vitamin K dependent clotting factors, mainly 2, 7, 9, 10. The warfarin and phenidiones are examples of the dicumarol. So in the warfarin, treatment of the warfarin is assessed by the prothrombin time, because it is acts through the extrinsic pathway. So we are assessing the prothrombin time. For the heparin, we give to assess heparin is acts through the intrinsic pathway. For the heparin treatment is monitored by the activated partial thromboplastin time, APTT. Natural anticoagulant, smooth vascular endothelium. It secretes the prostacyclin, which inhibits the platelet activation, and it prevents the activation of the factor 12. Smooth vascular endothelium produces the plasminogen activator and helps in the fibrinolysis. So smooth vascular endothelium is the important for the fluidity nature of the blood. And antitheramin 3 also important for the flow of the blood within the vessel. It inhibits the activated factors of the 9, 10, 11, 12. So it inhibits the intrinsic pathway of the coagulation. Protein C is acts as the natural anticoagulant, activated by the thrombin in combination with the thrombomodulin. Inactivate the factor 5A and 8A. This also activates the plasminogen activator. Protein S also acts as the natural anticoagulant. It facilitates the activation of the protein C. Heparin is the important natural anticoagulant. It is produced from the mast cell and basophils. And the thrombomodulin, it combines with the thrombin, activate the protein C. So thrombomodulin also acts as the natural anticoagulant. Thank you for watching this video. If you like this video, press the like button, share your friends. Those who are not subscribed this channel, please subscribe. In this videos, briefly discuss the physiology topics. You must read the physiology textbooks. Thank you once again.